Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a series of lectures on your heart. The feature presentation is Heart Attack Warning Signs and Signals. Many patients may experience some vague symptoms for weeks or maybe a few months before they actually get a heart attack. In fact, 30 to 40% of the people have no symptoms whatsoever until they get a heart attack. It's very important if you're getting vague signals, which I'm going to talk about, you should be thinking about possible heart problem and get appropriate check and evaluation. Just to give you an introduction to the coronary artery disease, which accounts for 95% of the patients we see in our cardiology practices. I just want to show you what a heart attack means. Then we're going to switch over to full PowerPoint presentation and continue with the presentation. The heart is supplied by coronary arteries that supply the blood to the heart muscle. Whenever there is a blockage of an artery, like as we can see here with the buildup of an atherosclerotic plaque, which encroaches on the lumen, and the last 5 to 10% may be caused by a clot. And when the artery is totally occluded, that area of the heart muscle dies, and that is known as the heart attack. How prevalent is this heart problem and heart attack? According to the February 2, 2022 statistics, 90 million people have heart disease in the United States. There is one heart attack occurring every 40 seconds. 805,000 people in the United States had a heart attack last year. Of those, 605,000 were having the first heart attack. Wouldn't it be nice if you can recognize some symptoms and signals long before you get a heart attack so you can get an appropriate medical checkup and treatment started before there is damage to your heart muscle? Yes, let's focus on, I'm going to switch over to the full PowerPoint presentation. 805,000 people in the United States had heart attack last year, and of these, 605,000 were of the first heart attack type. As cardiologists, we know the common symptoms when patients present with an acute blockage of an artery leading to myocardial infarction or heart attack, as it is called. They usually have crushing chest pain lasting for 45 minutes to 2 hours, associated with sweating, weakness, like almost they are going to pass out, a pain in the left arm, radiating to the left arm, radiating to the jaw, shortness of breath, dizziness, nausea. These are the typical symptoms of heart attack. But as I said, 30 to 40% of the patients may not have these typical symptoms, and a lot of these patients had no symptoms whatsoever before they developed the heart attack. So let us recognize some of the symptoms that may be present for weeks before people come to the emergency room with significant chest pain. Some of the things that we need to focus are like some abdominal symptoms, especially in the epigastric area. If you are having pain and you're having cramps or like a squeezing sensation, you should be concerned about it. And especially if it keeps happening repeatedly, then if it is something new, then it should really ring the bell. You not only get the evaluation from the primary doctor, and if necessary, get a checkup from a cardiologist. Gallbladder attacks have been looked at as heart attacks, and heart attacks have been misdiagnosed as gallbladder attacks, and people have gone for surgery. So let us not undermine the symptoms in the belly that may be coming from the heart. In fact, people who have like esophageal spasm can mimic heart attack pain, but it's related to the esophagus. People with hiatal hernia, when they encroach on the chest, they may be having chest pains, but it may not be related to the heart. On the other hand, the heart pains may be mimicking like a gastric ulcer or indigestion, or it may be like just gallbladder symptoms. So whenever you have these symptoms, and if they are recurring frequently, then you definitely need to take that into consideration seriously. The next thing is like lack of sleep. If this is a new symptom, and lack of sleep may be related to a lot of things, it may be related to stress, which can lead to restlessness. And if you can't sleep, you become more restless, you become anxious. That increases your adrenaline level, it increases your blood pressure, it increases the strain on the heart muscle, and you may feel weak and tired and just exhausted. And if you're having an anxiety, that can also mimic heart symptoms. So it's important, if you are having insomnia, to get some help, get the proper diagnosis, so that you don't end up in the emergency room with a heart problem. And another important symptom that we need to keep in mind is lightheadedness, little dizziness, little vertigo. These symptoms may not be directly related to the heart, but they may be indirectly related to the heart. Like if you are having low blood pressure, you can feel dizziness. If you are having like irregular heart rhythms with reduced circulation to your heart muscle, that can cause dizziness. If you are having extra beats, short runs of extra beats, that can cause dizziness. Most of the time, the dizziness is related to either blood pressure problems or related to irregular heart rhythms or related to reduced circulation as such because of decreased cardiac function. We may be limiting ourselves and not knowing it, and that can lead to some of these unusual symptoms. Again, dizziness. Whenever you get dizziness, you may have weakness, fatigue, lack of energy, and this may all be reflecting low cardiac output and poor circulation. Same thing with the dizziness. And you may feel like the whole world is spinning around and you were fine before, you have no idea what's happening. If you don't know what is happening, best thing is get a medical checkup. Next, blood pressure. Blood pressure is an important issue, especially if you have a mild high blood pressure or moderate high blood pressure. And if your blood pressure is elevated, you need to be concerned about it because it's putting more strain on your heart. It may cause headaches, it may cause dizziness, it may cause vague feeling, and it can also lead to visual problems. On the other hand, if you have an unexplained drop in your blood pressure, that should be of a major concern because that may be related to compromised heart function. The blood pressure is a product of a heart function against the resistance. And if the blood pressure drops, that means the pumping effect of the heart may have been impaired due to blockages and reduced circulation to the heart muscle. So keep in mind, if you see an unexpected drop in your blood pressure, then you should get immediate cardiovascular checkup. Same way, cold sweats. Cold sweats basically tell you that you are having reduced circulation. When do you get reduced cardiac output and cardiac circulation? That's when your heart is not able to pump adequately. That may be related to irregular heart rhythms. It may be related to damage to your heart muscle. It may be related to heart failure. But when you feel these cold sweats without any fever or any other constitutional symptoms, you should be concerned about. Make sure your sugar is okay, because if you're running low sugar, then also you can feel some cold sweats and weakness. If you're feeling tired, if you're feeling weak, you feel like you don't just have that energy, and you always feel like you just want to be isolated, you just want to be separate, you just want to spend a lot of time in the couch or on the desk, as the lady is doing. If you're feeling these symptoms which are new, then that may be a reflection of poor circulation. It may all be a reflection of other metabolic problems like thyroid problems. If your thyroid is low, that can give rise to these symptoms, and low thyroid also increases the risk of heart disease. It may be related to irregular heart rhythms. It may be related to anemia, like blood loss. Shortness of breath. This is a very important symptom. If you are getting progressively short of breath, before you were able to walk from the edge of the parking lot into the grocery store, do 1 hour shopping and come back to the car, no symptoms. Now all of a sudden you realize by the time you get out of your car and enter the grocery store, you are short of breath. If you're feeling that, you need to seriously consider what has changed. Why am I feeling short of breath? It may be related to low cardiac output, it may be related to anemia, or it may be related to reduced circulation to your heart muscle, reducing heart function as such. Take note of that and get a checkup. If you're having flu-like symptoms, and if these symptoms take a long time to recover, that should be a tip off. I said if it's an ordinary flu, you should be able to get over within a week or so. But if it keeps happening and you keep having these symptoms like little feverish, little fatigued, little short of breath, and these symptoms are happening more often, it could be sign of a heart problem. So, ladies and gentlemen, these are some of the unconventional symptoms that may be indicative of heart disease, low cardiac output, irregular heart rhythms, and many other things. So, if you are having these symptoms, make sure you get a clean cardiac checkup before you end up with a heart problem. Thank you so much for watching this presentation, and I will see you in the next video. We have a series of presentations on public education as far as heart health is concerned. You're welcome to watch that. You can also take a look at my book, Heart Healthy Lifestyle, where we explain all these things in very simple terms, and I will see you in the next video. Thank you so much.